Well, I want to thank you all for joining us today. I'm Congresswoman Bonnie Watson Coleman. I brought together this webinar discussion because over the last few months, my office has seen an increase in outreach from residents concerned about the rights of members of the LGBTQIA plus community, given the actions of our current president, Donald Trump. The Trump administration has issued several executive orders attacking transgender and gender nonconforming people through restrictions on federal gender marker, banning transgender service members from the military, preventing gender affirming care for being provided for people under the age of 19 years old, prohibiting transgender girls from participating in school sports. Over the past months, I've been working with an advisory board, particularly my staff has been very interactive with a series of leaders in this field to address these concerns. Today's Know Your Rights panel is a culmination of some of those discussions. Today, we are joined by Luis Vasquez, Senior Legislative Counsel for the Human Rights Commission campaign, and before joining that, he was a legal scholar with the Williams Institute of UCLA School of Law. Lewis's work focuses on federal and state laws, regulations, policies, and actions impacting the LGBTQIA plus community. To moderate this discussion, I want to also identify our other two experts in this area. Elyla Huertas is a senior staff attorney for the ACLU, and she's worked on a wide range of civil rights and civil liberties issues, including youth and student rights, LGBTQ plus rights, and protest rights. Aaron Potenza has worked for the Garden State Equality. He's worked for Governor Murphy's transition team and has served as the chair of New Jersey's Transgender Equality Task Force. The work of these individuals and people like them has made New Jersey one of the safest places for people to be their authentic selves. That said, all three understand, as many of you do, that there is still much more to be done, and that there is work that needs to be done to codify and to strengthen equality in New Jersey and, of course, around the country. To moderate this discussion, I'm going to turn it over to my friend, Senator Andrew Zwicker, with whom I share many of the same values. Andrew has served in the General Assembly from 2016 to 2020, and he has served in the New Jersey Senate since 2022. He is also a science educator, a longtime advocate for equality and freedom, and a good friend to any vulnerable population that needs his attention and his leadership. Senator Zwicker, thank you for doing this, and I now turn this over to you.
Thank you, Congresswoman. And before we start, I just want to say thank you personally to you for your leadership over not just the past few months, but for many, many years. Your dedication to vulnerable communities and to ensuring that everybody in New Jersey has basic freedoms. Your voice has been so essential, and I'm just personally very grateful for your leadership and to call you my Congresswoman. So thank you.
Senator, I thank you. This is why we're such good friends, because from the first time we met each other, we knew that there was more that we agreed upon than disagreed upon. So have a good panel discussion.
Thank you. And thank you, everybody, for logging on today. With so much hatred emanating out of Washington, a full-on assault on the constitutional rights of LGBTQ plus Americans in full effect, we've gathered here today to remind you of two important things. First, Trump and the federal government cannot erase your identity. And two, there are people and institutions in place to defend your rights as an LGBTQ plus American. We're going to meet and hear from several of those people over the course of the next hour. New Jersey is stepping up to protect the rights of our LGBTQ plus Americans and ensure that resources are available to the communities that need them. We're standing firm on DEI programs in schools. We're stopping book censorship and the New Jersey Freedom to Read Act, which Governor Murphy signed into law last December. And there are executive orders that he has put in place to shield gender affirming care and the health care workers who provide this essential health care from out of state attacks and attacks from the federal government. This next hour will be an important reminder of your fundamental rights as an LGBTQ plus American, and introduction to some of the talented individuals fighting tirelessly to preserve and defend those rights. So I'd like to start off by asking each of our panelists to have a few brief remarks and introduce themselves. And you heard from the Congresswoman their backgrounds. Why don't we start off with Luis Vasquez?
Thank you so much, Senator. It's a pleasure to be here. I'm really grateful to you and to the Congresswoman's office for organizing this opportunity. And absolutely, I think you hit the nail on the head about just the volume of attacks that our community is currently facing. From day one, President Trump has clearly made it one of his priorities to attack the LGBTQ plus community, to try to divide us, to try to get rid of so much hard work that's been put into place, not only to benefit our communities, but to benefit all marginalized people throughout the United States. And I'm so grateful to see that people want to hear about what their rights are. They want to stand up and fight, and that we have states like New Jersey that are putting in that work to make sure that we do keep on fighting. Because at the end of the day, the president is not in charge of the law. He does not get to rewrite the law to suit his whims. And so it is so critical that we have states, organizations, individual people continuing to push back against that hatred and show them that we will not allow our communities to be divided, and we won't allow our rights to be eroded at this important time. And so again, I'm really grateful for the opportunity to be here to speak. I will turn it over to the other panelists to briefly introduce themselves, and I'm excited to talk more in the weeds about some of the issues and about some of the rights that folks still have, regardless of the smoke that's coming out of Washington.
Thank you. Next, I'd like to ask Elyla Huertas, Senior Staff Attorney from the ACLU of New Jersey, for brief opening remarks.
Good afternoon, everybody. My name is Elyla Huertas. I'm a senior staff attorney at the ACLU of New Jersey, an organization that's working to protect civil liberties and civil rights throughout our state. I, in that role, have done a lot of work in the past couple of years on LGBTQ rights. And as the previous panelist mentioned, Luis, during this time, this work is especially important, and I'm very honored to be invited to this panel today. To discuss that. Excuse me, I'm struggling a little bit with allergies. I apologize, as I'm sure other folks on the call are as well. But yes, thank you to the folks who put this panel together. I think this is a very important discussion to have, and I'm honored to be here today.
Thank you. And finally, Aaron Potenza, Policy Consultant from Garden State Equality.
Hi. So I also want to thank the Congresswoman for bringing this together, for the tireless work that she's done on this issue, as well as other civil rights issues, and also to Senator Zwicker, who's been such a steadfast ally to the LGBTQ community in New Jersey, working on a lot of pieces of legislation over the years that have made New Jersey one of the safest states for LGBTQ and particularly transgender people. To give you a little bit of background about myself, I live and work in New Jersey. I'm a transgender man. I served as policy director for Garden State Equality from 2015 to 2019, so did work under both a Republican and Democratic administration to put forward a lot of the laws that we have in New Jersey. Currently, I served as chair of the Transgender Equality Task Force that Governor Murphy stood up back in 2019, 2020. And I do policy consulting for a number of nonprofits around the state at this point, including doing policy consultation still for Garden State Equality on this issue. I guess the only other thing I would say is that there is such a hunger for this right now, that I have been doing a Know Your Rights training, decoding Trump's executive orders. And I would say that, I've I've been doing that around the state for the past 3 months, and it's just been the presentation that I have updated the most ever, right? Like every week I'm having to go back into these 60 slides and update things because so much of this is happening so quickly. There's a hunger for the knowledge about it in the LGBTQ community. And just to kind of reiterate what some of the other panelists put forth, that we do have strong state law here in New Jersey. A lot of these actions are unconstitutional. They've been enjoined by the courts, and we need to keep that in mind.
Thank you, Aaron. And thank you to all our panelists for being here today. Aaron, I want to start off the questions with you. And for all our panelists, let's start by talking about gender affirming care. So Aaron, maybe you can lead us off with a brief couple of minutes on what is gender affirming care and what is it not?
Sure, that's a great question. So gender affirming care can include many things. It can include talk therapy. It can include gender affirming hormone therapy and even surgical interventions to bring the body into alignment with an individual's gender identity. From a personal perspective, because I think that can sometimes be helpful for folks, when we talk about hormone therapy, we are talking about, for someone like myself who was assigned female at birth, I take testosterone, right? For individuals who are assigned male at birth but identify as female, they may take medications to suppress their testosterone levels and as well as estrogen to bring those levels up. But we often, so much of what we're hearing in the media, so much of the way this is being talked about is centered around young people, particularly youth, but also in this executive order, extending to anyone under 19 years old, so including some adults. And so I think when we think about that, we also talk about puberty blockers. So for someone who's already gone through puberty, they wouldn't take puberty blockers, right? So someone such as myself, right? But puberty blockers are for younger children who have not yet gone through puberty. And the utility of those is to stop them from going through a puberty that doesn't align with their gender, that would bring them significant stress, and that could lead to the need for future surgeries that they may not need if they do puberty blockers. I think it's really important to note that these are safe and effective medications that have been used for decades to treat other conditions, including precocious puberty in young people under the age of 8 or 9 years old who start puberty. These are prescribed for that reason. Nobody's trying to regulate that. Nobody's saying these kids shouldn't have access to that if they're going through a precocious puberty, but they're being regulated, right, primarily for the purpose of denying trans youth access to this life-saving medication. I think that's important to touch on also from a legal standpoint. But my main point here is that So some of this is talk therapy. It can be hormone therapy. It can be puberty blockers. It can also be surgical interventions. There's a whole, host of surgical interventions a person could opt into. But I think when we think about this with young people, a couple of things are really key to put out there. First of all, there's no gender affirming care provided to anyone under 18 in this country without parental consent. So in effect, and the process of accessing care is lengthy. So basically, in effect, to deny that care is to deny the rights not only of that young person, but the rights of their parents to decide what's the best course of treatment in consultation with their doctors. I think the other really important thing to put out there is that in the United States, there are an estimated 300,000 youths 13 to 17 years old who identify as transgender. And a large-scale review of health insurance data found that between 2017 and 2021, so this is a 4-year period when this supposedly emerges as an epidemic of gender-affirming care provision, only 4,780 adolescents began puberty blockers. Of those 300,000 youth, 14,726 began hormone therapy. Surgical interventions for trans youth are exceedingly rare, with top surgery for older trans masculine teens being the most common. And again, all of this is performed in consultation with the doctor. It is understood as best practice medical care. It is something that every major medical institution, expert body has affirmed the right to, has said is, they agree with and is important. And that's contrary to the picture that the Trump administration is painting here, right? So if we look at the language of these executive orders, they are talking about maiming. They are talking about genital mutilation. There are legal reasons they're kind of using that type of language. But they're also talking about countless, there's a quote in that executive order that says countless children soon regret having access to this care. And then they just kind of reiterate this, talking about this is something that's being done to children, that children are then coming to regret when they realize, right, what's been done. But I think it's really important to note that the detransition rate is exceedingly low for trans people, including trans youth. Access to gender affirming care, accessing that care has been found to have much lower rates of regret than other types of care. Literature has found, lit reviews have found a detransition rate between 0.3 and 3.8%. And the Cass review, which is commonly cited by folks who want to deny young people access to this care, even that review out of the UK looked at a sample of 300,000 individuals who had received gender affirming care in their youth and only could identify 10 cases of detransition. So I think we need to keep in mind both what this is and what it is not, and think about how it's being framed.
Thank you, Aaron. And Aaron, you mentioned a couple of times the legal perspective, so I'd like to bring Luis in to talk more about that. So Luis, can you start to your next comments about the legal perspective for healthcare providers of gender affirming care? Talk about some of the current limitations, ramifications, and roadblocks the current administrative decisions and actions have created.
Yes, absolutely. I think Aaron brought us to a really good place in mentioning the executive orders that have come out of the Trump administration, right? So many of the dozens of orders he's issued targeting the LGBTQ plus community are specific to trans people. They are specific to gender affirming care. And, I absolutely really feel for parents of trans kids, for young trans people themselves who are taking in all of this news and trying to understand what exactly is going on. What does it all mean? And I can say, right at the top that at this moment, gender affirming care, the wide range of services that comprises, it can still be provided wherever state law allows that type of care to be provided, right? Many of you might have heard over the last couple of years that there have been some states that have actively moved to ban gender affirming care in their states, in particular for minors. Those bans still stay in place, but they are limited to their states. And so when we're thinking about the country as a whole, when we're thinking about states like New Jersey that have implemented those types of bans, gender affirming care remains legal despite what the Trump administration is saying, despite what they're trying to put out there. Now, I do want to dive a little bit more into some of these specifics, right? What exactly is it that the Trump administration is laying out there? And I believe later on in this panel, we're going to dive a little bit more into what exactly an executive order is. So I will save some of this discussion for that time. But in short, an executive order does not change the law. It is not something that is self-executing. And so even as these orders contain all of this vitriol, all of this terrible rhetoric about gender affirming care, that doesn't suddenly mean that gender affirming care is all of those terrible and bad things. Similarly, just because these orders direct government agencies to take certain actions to try to limit access to gender affirming care doesn't mean that those actions are already taken. Agencies actually have to work to put those plans into place and implement them. They have to put in the work as well to combat legal challenges to the executive orders themselves, as well as to their following activities. And those legal challenges are a big part of why I can confidently state that folks are still able to access gender affirming care, even as some agencies have started moving to enact some of these mandates from the president. There are injunctions in place that have made sure that these orders have limited effect at this time, that are slowing down the rollout of some of these initiatives. And so again, this care is something that is still accessible. It remains best practice care. It has not suddenly changed into this new classification of being mutilation or however else the administration wants to paint it. But what can we expect moving forward with this administration? You know, what have they laid out in these executive orders in terms of what they would like to do? So we know that their attacks are really, at least right now, focusing along what I like to think of as two different routes. The first is going after providers, and the second is going after the ways that individuals can get this gender affirming care actually paid for, right? It's one thing to have a provider that can give you care, it's another to actually be able to pay for it and to utilize those services. And so for providers, the administration has directed agencies to work to prohibit any provider that receives federal funding from then providing gender affirming care. And they are looking at this very broadly. So even if federal funds aren't being used to help provide gender affirming care, the Trump administration still clearly intends on going after those providers to try to just completely make them pick. Either you get federal funding for these other things and provide no gender affirming care, or you provide gender affirming care and you get no federal funding for anything else, which is absolutely, you know, a dangerous route to go down. And we've already seen as well that the administration is trying to really put the pressure on providers, even as some of these legal challenges play out, including by setting up a tip line for, quote, whistleblowers that would like to report providers specifically that are rendering services that are gender affirming care. But as we noted at the top of this discussion with Aaron, gender affirming care is a wide range of services, and not all of them are completely medical in nature. And so this is something that could have really broad implications for a wide range of providers. And then the second route that I mentioned is going after these funding streams, the ways that individuals can pay for their care. In one of the president's executive orders, we saw very clearly some of the targets that he has in mind. For example, TRICARE, which provides coverage for the dependents and family of our service members. He's hoping to completely bar that type of coverage from being used to provide gender affirming care. And that is something that I would note is likely to go through given the authority that the president has over the armed services. But they'd also like to go after other funding streams, including the flexibility that states have to use their funding like Medicaid to be able to provide this care. They also have put out proposals that would prohibit states from making it so that their marketplace plans under the Affordable Care Act have to cover gender affirming care related services as an essential health benefit. That's not something that every state in the country has done, and it is not going to constitute a total ban on coverage out of these plans. But again, it's just another way for the administration to try to make it harder and harder for individuals to actually access the coverage and the monies that they would need to get to care. We are not at that point yet, right? And to close, I really want to make it clear to folks that these are all proposals that they put out. These are all ideas. None of these things have been fully implemented. These consequences have not started completely flowing yet. And so individuals should not feel like their access to care has already been completely cut off, but clearly the threats are here and they are coming.
Thank you so much, Luis. Really appreciate that perspective from the legal point of view, and your thoughts on both where we are and what some of the concerns are and what some of the protections are. Elyla, I'd like to bring you in now to talk about New Jersey specifically, and really, if you could take us through, where things stand in New Jersey, legislation regarding this, the legalities, the rights for folks who are trying to obtain gender affirming care here in New Jersey, and what can New Jersey healthcare providers currently provide?
Yes, thank you so much. So as Luis mentioned, states are very much involved in protecting, in some cases, attacking this gender affirming care. But in New Jersey, luckily, our administration has taken steps to protect that care. So back before this administration, back in 2023, in April of 2023, the New Jersey governor, Phil Murphy, signed an executive order, a New Jersey executive order, establishing New Jersey as a safe haven for gender affirming healthcare. It was passed in response to what was at the time increasing attacks led by other states to that care. And according to a statement released by the governor's office at the time, the aim of the order was to ensure that members of the LGBTQIA plus community in New Jersey, including trans and non-binary youth, are able to enjoy equal access to quality healthcare services, regardless of their sexual orientation, gender identity, or gender expression. So that executive order number 326, establishes, like I said, New Jersey as a safe haven. So under that executive order, all state departments and agencies are directed to protect all people, including healthcare professionals and patients, against any potential repercussions resulting from providing, receiving, assisting in providing or receiving, seeking, or traveling to New Jersey to obtain that care. The order also does some other things, like barring the extradition of individuals within New Jersey. So not just New Jersey residents, but also just individuals within New Jersey. So prevents them from being extradited to other states for providing or receiving that care. Also importantly, departments and agencies within New Jersey are prohibited from cooperating with any kind of interstate investigations that aim to hold someone liable. So this was a pretty expansive executive order, just making it clear that, like I said before, that New Jersey is a safe haven and that we will protect those within our state who are not only receiving but also providing that care, which, you know, like I said, this was actually passed before the administration, before the Trump administration took office, and that executive order is still valid today. Thank you.
Thank you. And just following up on that, I'm the prime sponsor of the legislation to codify that executive order because Governor Murphy is term limited at the end of this calendar year. So we want to make sure that the protections that you talked about in his executive order remain regardless of who the next governor might be. Also, Senate Majority Leader Teresa Ruiz has the legislation to shield healthcare providers and others who are performing gender affirming care from other states and laws that they may be passing. Elyla, I want to stay with you though as we move to the next topic, which is schools, and talk in particular about safety and school environments here in New Jersey. So can you talk about both current New Jersey legislation, some of the education stats on guidance for transgender children in schools, what counties and municipalities are doing to codify LGBTQIA plus safety within their school environments? And let's sort of burrow down into what's going on in schools right now.
I'm happy to, and I'm grateful to be able to talk about this because we have seen some attacks at the local level. Luckily, it hasn't been in the majority of school districts throughout New Jersey, but we have seen it. And so I'll start by saying that the previous New Jersey administration, so under former Governor Chris Christie, there was a law that was signed in 2017, which directed the New Jersey Commission of Education to provide school districts with guidelines concerning transgender students. So that was released in 2017 under the previous administration. And then following that law, 4 stakeholder meetings, 2 held during the Christie administration and 2 during the Murphy administration, so 2 different administrations. The New Jersey Department of Education then released what is called the Transgender Student Guidance for School Districts, and that was back in 2018. So that important document reiterated the statutory and constitutional protections that are afforded to transgender students. But it also made clear that LGBTQ guidance, LGBTQ students retain privacy rights. So from that guidance, school districts throughout New Jersey, and there are 600 plus school districts, created, or many of them adopted what has been known, what is now called Policy 5756. So that's a policy that was created kind of taking what was in this guidance that was born from this law, and basically creating a roadmap for school districts on how to make sure and ensure that school districts are safe environments for trans and LGBTQ students. And like I said, it came out of a way to help districts kind of navigate their responsibilities, and also make clear for these school districts what their responsibilities are, both from federal and state law. And this policy was put in place. These policies are put in place for good reason. They help to ensure that district employees, administrators, staff, do not run afoul of any of these laws, and know how to protect students. And so, luckily, a majority of the school districts adopted this policy. Unfortunately, in about it's April, so about for the last year. Or a year and a half, we've seen some school districts take steps to take policy 5756 off the books. Like I said before, there are 600 plus school districts, and we've seen about 20 or so take steps to revoke this policy from their districts. And when we see that, we, along with our partner, Garden State Equality, reach out to these school districts and let them know that even if they were to revoke this policy 5756, that doesn't absolve them of their responsibilities under federal and state law. They are still required. They still must ensure that all students, including trans students, non-binary students, are protected in their schools, and that they are. And we also encourage them to consider putting the policy back on their books, because, making their policy part of their, making sure that their policy is still on the books, because it's also a great signal to the students within their school district that this school district is a safe and welcoming environment for their students. So like I said, we, for about the past year or so, have been, whenever we find a school district has revoked this important policy, we, along with our partner, Garden State Equality, have sent letters to these school districts, making clear what the state of the law is. So that's one way that New Jersey has protected LGBTQI plus students, but also under the New Jersey law against discrimination, which is a wonderful law, which is the most, and I'll talk about this a little more later, but one of the most expansive non-discrimination laws in the country. Under that law, it is also that protects students from discrimination, and the LAD, which is what we generally refer to that law against discrimination as, generally makes it unlawful for schools to subject individuals to differential treatment based on things like race, creed, color, national origin, ancestry, marital status, domestic partnership, or civil union status, sex, affectional or sexual orientation, gender identity or expression, disability, or nationality. And this law applies to all places of public accommodation, including schools. And lastly, as part of, there's also a law in the books that as part of their curriculum, New Jersey law requires that boards of education, their learning standards and policies recognize and cover the political, economic and social contributions of the LGBTQ plus community. So those are a couple of protections and laws that are currently on the books that are protecting LGBTQ plus students in New Jersey.
Thank you very much. Appreciate that. And knowing that our law against discrimination is as strong as it is an important thing to bring out. Luis, I'd like to bring you in to talk about where things stand at the national level when it comes to the legal rights of LGBTQIA plus youth within schools. Are their identities protected? Can school administrators or teachers advocate for student safety? And what legal rights do staff and students have regarding safety within their educational organizations?
Question, Senator. I think it's something, right, that we were mentioning before during our discussion on healthcare, just how many attacks, how much activity there's been coming out of the federal government when it comes to that area. And of course, education is not far behind, if not even perhaps it's equal. In the educational space, right, I'm sure we've all been hearing so many stories of everything the Trump administration is trying to do to radically change our educational system here in the United States, whether that goes from turning federal agencies to start attacking school districts and even entire states for their decisions to outright trying to dismantle the Department of Education itself. Right? We know that there's a lot happening, and that includes a lot of targeted attacks on LGBTQIA plus youth, teachers, their families, and so many sources of support that they have. And so right off the top, to answer your question, and I think this is something that folks will need to get used to hearing me say a lot throughout our discussion today, is that regardless of what the president has said, the orders that he has put out so far, federal law has not changed. And it will not change simply because he would like it to. The work actually has to be put in to change it. And so as it stands right now, federal law still protects all students' right to equal educational opportunity. And as defined by certain statutes, including Title IX, that right includes the right to be free from discrimination and harassment. This is something that extends to teachers, to students, to other folks that are involved in these children's education. And so folks should still feel like they have the weight of the actual federal laws behind them, even if the Department of Education itself might not be. And so if folks feel that they are being harassed or discriminated against, if they feel that they do have concerns regarding the safety of students or anything else in their educational organizations, they should still feel empowered to seek recourse, not only under state law, but also under federal laws like Title IX. Unfortunately, some folks in the audience may be familiar if you've ever had to pursue a discrimination claim, say at your workplace. Normally, there are government agencies that you have to take your claim through. You have to follow certain administrative steps before you're allowed to sue. That is not the case when it comes to Title IX. Individuals are allowed to sue directly without the aid of the Department of Education. And so regardless of whether the department stays or goes or how it continues being run by the Trump administration, folks should still feel like they have that ability to seek their own counsel, to go to court and try to vindicate their rights regardless of what the administration itself is doing or how they're trying to posture the law. You all may have heard in stories lately that indeed the Trump administration is trying to weaponize its own views and its own interpretation of the law to go after schools. Again, though, this is their interpretation. It is not binding on the courts. It does not change what these laws actually mean. And so, for example, a couple of days ago, the Department of Justice filed suit against the state of Maine, alleging that they were violating Title IX by having a transgender inclusive sports participation policy. But that doesn't change the fact that numerous courts across the country have held that discrimination against transgender students does constitute unlawful discrimination under federal laws like Title IX. It doesn't change the range of decisions going all the way up to the United States Supreme Court that have extended protections under discrimination laws to LGBTQIA plus people, even if we aren't explicitly mentioned in their text. Those decisions have not gone away. And so folks, again, should feel like they still have that recourse. They still have some protections when it comes to trying to advocate for changes, trying to make sure that they are actually there supporting these youth who so desperately need our help, especially right now when the administration is doing so much. All of that being said, though, right, I do want to caution folks to, again, think about the fact that, unfortunately, the administration is weaponizing these departments that have, for so long, been partners of ours and have worked to try to implement inclusive policies and push back against discrimination, that they are now on the other side of the table and they are actively trying to work to actually dismantle some of these protections, to again go after schools that have good policies for our youth and our communities. The executive orders that we've been discussing throughout this discussion they include recommendations for who government agencies should go after when it comes to implementing the president's vision of the law. And when it comes to education, unfortunately, they do directly, name teachers and school staff as individuals that they might decide to target when it comes to trying to implement these provisions. And so I do not want folks to come out of this feeling they're completely insulated from anything the Trump administration might try to do. Unfortunately, they do have, quite a big group of government agencies and folks that are out there trying to do that work for them. But again, that does not change the protections that the law provides. That does not change, especially not the protections that state law provides. And so folks should continue engaging with those legal protections, continue doing the great work that we've heard about during this discussion to make sure that even if the federal government isn't going to be a good partner in this sense, that the state government can still be a good partner, and that wherever there are threats to student safety and even to teachers' ability to advocate for their students, that the state itself might be able to stand up. We have seen that happen in Maine. I'm confident that we can and will continue to see that by other states pushing back against this hateful agenda.
Thank you, Luis. Aaron, I'd like to bring you in to talk about what we're seeing right now with the impact on youth. I can tell you personally, I hear regularly from family members of LGBTQIA plus youth who are fearful for their child's mental and physical safety. They feel enormous pressure. So, can you talk more about what we're seeing right now when it comes to youth mental health, suicide rates, and the overall impact of not having a safe environment at school and all of the headlines that are going on right now?
Yeah, absolutely. So if we take this back kind of prior to the Trump administration, and this is a longstanding problem for LGBTQ youth, which is the problem of not being in a supportive environment, whether it be at home or in the broader community, including schools. And that of course predates this administration, but we're seeing this really ramp up. And so I guess the first thing I would want to say is that there is a wide body of evidence on this, that there are decades of peer-reviewed research that shows that trans and non-binary and more broadly LGBTQ youth have significantly elevated levels of depression, anxiety, substance abuse use, and suicidality, and that those issues are reduced. And some studies show they're reduced to the level of a cisgender child of similar background. So usually they'll do a sibling study to account for, other differences that to kind of like clean that out of the data when they're supported in a transition. So that is to say, support for these young people has been shown to drop those levels of anxiety, depression, and suicidality, and even substance use and sort of secondary things like that, down to the same level of a child who is not transgender if they have that support. But certainly young people don't always have that support. And that's a really big issue in the LGBTQ community. For years, we've talked about levels of youth homelessness being just sky high in this community. Some estimates put that at 40% of the out-of-home youth population, when LGBTQ youth account for maybe 6, 7, 8% of that population more broadly. So very big discrepancy there. And we kind of see that there is a need for that support in all these different spaces, right? Including in schools, because oftentimes these young people are not supported at home, and school can become kind of if school can be a safe space, and we've done a lot in New Jersey to make that the case by law, then this can be maybe the only place this student feels comfortable being out, feels support, is affirmed in their identity, which is critical to their mental health and to their ability to stay in school and have all these positive effects later on from that engagement. So I think when we then look at this after the election, or even predating that a little, looking at the state laws that have been passed, not in New Jersey, But in a lot of states around the country that target transgender youth, we see the opposite, right? That when people are targeted, when young people are being targeted, they have even worse mental health outcomes. So there has been a study done by the Trevor Project that found that, and when they did this study a few years ago, so they're looking at that point at statewide laws and bills, 86% of trans and non-binary youth were saying that recent debates around anti-trans bills had negatively impacted their mental health. As a result of hearing about those policies and debates, 45% of them said they experienced increased cyberbullying. Nearly 1 in 3 reported not feeling safe to go to the doctor or hospital when they were sick or injured. And this is around this question of hearing more in the news or in the community about these anti-transgender bills. They have just come out with new data on that. And now we're seeing, this is exponential, right? Because if you look at these state bills, I have a chart of it where it's like, back in 2015, we're seeing, a few dozen of these introduced in state legislatures. By 2025, we already have 700 plus bills introduced, and it's April. And now we have this situation on the federal level with the executive orders, with the language the Trump administration is using, and with some of the administrative actions that have followed those executive orders. And Trevor Project did that survey again, and it went from 86 to 93%. So we're talking about essentially almost all, a vast majority of trans and non-binary youth saying this has really negatively impacted their mental health. Looking at the queer community more broadly, 75% of LGBTQ youth also say this is negatively impacting their mental health. So these kids may not all identify as trans or non-binary. They may identify as lesbian, gay, queer, intersex, asexual, another identity, right? But that they still see this as part of their community and understand that this is a broader threat than just to trans people. And that 75% are saying it's giving them increased stress or anxiety. I guess the other thing I'd want to touch on there, after kind of sharing why this is really important in an educational setting, right? That young people may not be supported at home. And so this is a space where they can find that support. I think when we look at the New Jersey context and some of the work that Elyla touched on with both the trans student guidance, the work that was done there in committee, and then in the committee within the education department, and then also the bill mandating a diverse curriculum that covers contributions of LGBTQ plus people, as well as persons with disabilities, that these things, unlike the law of against discrimination, can change, right? Not to say law against discrimination could never change. Iowa just took gender identity out of their civil rights law, gender identity and the expression, which is horrifying. I don't see that happening in New Jersey. And I mean, you never know, but I'm going to say I don't see that happening in New Jersey. But the guidance and the law mandating that an inclusive curriculum, that can change, right? And so I know, Senator Zwicker, you are prime sponsor on legislation to codify the guidance. I've worked on that. I worked on the committee within DOE, and I've also worked with community members and other advocates to work with your team on that bill to codify the guidance. And I think this is critical because we know that in New Jersey, there's already, as Elyla pointed out, there have been a handful of districts, not a large amount of districts, but a handful that have tried to kind of, by revoking policy 5657, get around the guidance. And of course, just revoking the policy does not mean that they can. The Attorney General has been very clear on that. But we have a gubernatorial election. We have an election in the General Assembly coming up, and the outcomes of elections matter, right? So the outcome of that election, we have on the Republican side, almost every single one of the candidates who are running to be the Republican nominee, with the exception of Brown, which is important to say, have been very anti-LGBTQ, whether it has been a through line of their career, something that they built their name on, something that they've been about for 20 plus years, or whether they've just kind of said, in order to continue in Republican politics, this is where I have to be at now because this is where MAGA is at. And so this is who I'm going to be in this moment. Regardless, they've been very clear that they do not support the transgender student guidance, that they do not support gender affirming care, and that they do not support an inclusive curriculum. They frame this in terms of parents' rights. And we have seen Moms for Liberty, which is a sort of like parents' rights, anti-trans, anti-science, and anti-DEI organization. It started out very locally. They have kind of like these boilerplate letters that they have given to parents groups in New Jersey to get them to send letters to their school boards saying, you know, this executive order came down. What are you doing about it? You can't stand on the side of New Jersey law. You have to stand with the federal law. Now, we know that from a legal standpoint, this is meaningless and ridiculous, but nonetheless, this is happening on the ground and this affects young people. And I guess the final thing I would say about that is, you know, the law to me is one of, if not the most important tool we have. It's one of the most important tools we have. But just because we have great law doesn't mean, right, that gives us recourse, but it doesn't mean that that's always followed. And so when I was doing this work with that committee within DOE, as well as with the task force, we hosted meetings around the state to hear from different communities. Primarily, these were trans people, including trans youth, as well as a lot of parents of supportive parents of trans youth who, you know, were sharing that, you know, it's great here up in this community, it's terrible here down in this other community. And regardless of the fact that the law exists, you still have, of course, school districts that aren't creating affirming environments. And you need young people to understand their rights and understand that they can bring that forward. But what they're hearing from the local community may not, right, may not be supportive. And so it's really important that we move forward in this work. There's a lot more to be done. And certainly, I think a big part of moving forward right now is to get this guidance codified, is to shore up what we already have, because again, there's an election coming up.
Thank you, Aaron. We're getting near the top of the hour, and I want to make sure we have time for any closing remarks that each of you have. But before we go there, Luis, we've heard a lot about executive orders, and just want to make sure that we've captured everything when it comes. Aaron started talking about it, you talked about it, Elyla's talked about it. Anything else to add about the legalities of an executive order, what their effects are, what they are not, that we haven't addressed yet so far?
Yes, absolutely. And I'll try to be quick since I know we're running out of time. But the thing I really want to leave folks with is that an executive order, again, is not a changing of the law. When we think about our branches of government, the executive branch's job is not to create laws, it is not to interpret laws, it is to enforce them. And so an executive order is merely a tool in their toolbox to guide that enforcement. It shows their policies, their priorities, might have some commands for agencies, but it isn't something that's self-executing, and it isn't something that changes the law or even how bodies like courts are going to interpret the law. And so while the president has and will continue to issue these executive orders filled with terrible rhetoric that's not binding on the courts, that's not binding on Congress, and it's not binding on us. And so folks should continue to really look at how are those orders being implemented in thinking about whether or not their rights are changing, what things they have available to them are changing, because otherwise those things are not self-executing, and we do have to wait for more before we really know what impacts the administration is going to have. But in and of themselves, executive orders do not change the law.
Thank you. Really appreciate the three of you and all of your time and your comments and your advocacy for both the people of New Jersey and nationally. I'd like to give you each 2 minutes for any closing comments, anything that we haven't gotten to, or things that you want to make sure our audience is aware of. So Elyla, why don't we start with you?
Thank you so much, Senator Zwicker. It's important that we continue to have these discussions. I think Aaron mentioned before that things are constantly changing and evolving under this administration. And so one of the most important things we can do is make sure that folks have the information and the tools that they need, not only to make decisions that they need to make for themselves and to make sure that they're safe, but also to advocate. Of course, it's important that we have laws on the books that protect folks, LGBTQ plus folks, but we also need to make sure that we're advocating to make sure that our protections are get even stronger. I know Aaron mentioned, taking steps to codify existing guidance, and that's going to be very important. And then beyond that, making sure that folks just understand the protections that are currently at their fingertips. And so, I mentioned before the law against discrimination, and that's it's a very powerful tool that we have in New Jersey that protects folks. And so I know here at the ACLU of New Jersey, along with some partners throughout the state, want to try and create like a fact sheet that folks can look at to understand what their rights are here. And so I will tell folks to be on the lookout for that. We're hoping to get that out to share with people so that they understand when and how they are protected. So I just wanted to tell folks that is forthcoming. But in the meantime, let's continue to have discussions like this, and let's continue to help ensure that we keep each other safe. And yes, especially with everything that is coming from the current administration. So thank you so much for including me.
Thank you. Thank you so much for all the work you're doing. Aaron, some final thoughts?
Make sure that I'm not muted. Okay. To the community, kind of wanted to reiterate some of these rights that people do have here in New Jersey. So I think it's important to note you have the right to access gender affirming care. As we said, New Jersey is a shield state for gender affirming care. We also have law on the books that mandates that insurance companies in New Jersey can't just have blanket exclusions for gender affirming care. You have the right to privacy in school settings. The New Jersey Superior Court upheld an injunction that blocked Monmouth County school districts from implementing policies that would have forcibly outed students. LGBTQIA discrimination is illegal in schools. The LAD is very clear on this. You have the right to participation in sports, right? That's been a topic we didn't get a chance to touch on, but has also been very much in the news lately, something that a lot of states have placed bans on and that the Trump administration has issued an executive order on. But the New Jersey State Interscholastic Athletic Association has been very clear. Students in New Jersey are eligible to play sports consistent with their gender identity. They have had this law in the book, or not law, they've had this policy in place since 2009. So that's 16 years. They have never had a single complaint about a transgender student playing. And they're going to keep the policy in place regardless of this executive order. And also, finally, I would just note trans people in New Jersey, folks who identify outside the binary, you can still obtain name and gender marker changes on all New Jersey issued documentation. So a birth certificate if you were born here, your New Jersey driver's license, you can get a gender marker that matches your identity. And really at this moment probably behooves you to do so. So just put that out there. And I just want to thank you, Senator, and also the Congressman for hosting this important conversation.
Thank you, Aaron. Luis, some final thoughts.
Yes, thank you so much. I really want to encourage folks in line with what my co-panelists have said, how important it is to not pre-comply. If the Trump administration wants to radically change our country, if they want to change our rights, our ability to access best practice healthcare, they should have to put in the work to do that. By pre-complying and going along with his mandates and executive orders before they've actually put in the work, it makes it so that they don't have to put in the work. And we know that in so many cases, not only have they not yet they might not. They might not be able to do it in a way that's legally sound. Here at the Human Rights Campaign, our foundation arm and Lambda Legal have successfully been suing the Trump administration for its ban on transgender people serving in the military, and that nationwide injunction is still standing to this day. And that shows how important it is that we not only not pre-comply, but continue finding ways to push back, that we continue to show our community members that we support them, that we do not go along with the changes that this administration is proposing that are quite frankly un-American. And so I really do hope folks on this call feel more empowered to have these conversations, to be willing to really use your rights and to access them, and to make sure that this is not a fight that we give up without actually fighting. So again, thank you so much to all of you for being here, and to the Senator and the Congresswoman for organizing such an important discussion for us.
Thank you, Luis. And I just want to say finally, thank you to Luis Vasquez, Senior Legal Counsel of the Human Rights Campaign, Elyla Huertas, Senior Staff Attorney, ACLU, New Jersey, Aaron Potenza, Policy Consultant, Garden State Equality, for all of your efforts and your thoughts and your advocacy that we've talked about over the last hour. And of course, Congresswoman Bonnie Watson-Coleman for putting us together, organizing this as we continue not just this discussion, but this fight against our basic human rights. I'm State Senator Andrew Zwicker. It was my honor to moderate this conversation, and I look forward to working with each of you as we move forward. Thank you so much, everybody.